Welcome to the lecture on the central nervous system. This is part one. I split it into two, so it's not so onerous. And central nervous system, brain and spinal cord. So you imagine knowing how delicate and complex this part of your body is, all the things that can go wrong. You can basically split it into infections, talk about meningitis and encephalitis, vascular issues, stroke mainly. So infections, vascular, neoplasms, the brain cancers, and trauma too, of course. So we're gonna hit all those, just kind of the highlights. And we have a separate lecture on mental illness, which is brain related, obviously, but we'll separate that out. All right. Here we go. So indeed, just a quick review, of course. You guys, this was a big section of A&P, a complex section, so I won't go through it all. But our brain, human brains, are mostly cerebrum. Huge, convoluted, it overtakes all the rest of your brain like a huge cap. This is for higher thought, higher functions, memory. And then the next biggest part of our brain is the cerebellum in the back for coordination, motor movements. And then you're left with the brain stem right down the middle. So up here, part of the forebrain is that diencephalon, the thalamus and hypothalamus, which has all kinds of important things in it, right? Midbrain is small, has some auditory and visual reflexes, and it's a conduit up and down. And then the pons and medulla. And when you get to the base of the brain like that, the brain stem, that's where you hold all your basic functions of life, like breathing and heartbeat and vomiting and coughing, the things that are just basic as opposed to intellectual, arithmetic, and language, right? So if the brain is damaged, you should look on going from the cerebrum down. If it damages the brain stem, you're not going to live. That's really, really bad because that's holding the center for your functioning of your body, right? All right. And just, you guys can feast your eyes over this and recall learning all that. As you're thinking, you're using especially this frontal cortex here, right? And then we got this precentral, postcentral gyrus for all the motor and sensory. Yeah. The vision is back here in the occipital lobe. The temporal lobes are for hearing and other senses, integrating them right there. And yeah, very cool. Yeah. And for speech, remember motor speech and sensory speech, Broca's area and Wernicke's area. Yeah. Here's going to be for making the words, telling your tongue and your larynx what to do. And a region over here is coming up with the words, right? And understanding language. Yeah. And there's a right and left hemisphere of your brain. And they operate opposite halves of your body. And most people have a dominant hemisphere, and that is where you find the speech, not on the other side. And so most people, it'll be on the left hemisphere, will be their dominant one with the speech. And a lot of the arithmetic too. The non-dominant's important for spatial reasoning, facial recognition, but parts of your brain can take over if parts are damaged, but that's the general gist of it. And you look at it, it's in the brain, you have gray matter on the outside, the cerebral cortex with all those neurons, all the connections, the divergent and convergent circuits that are going to allow you to have amazing memories and ability to make decisions. The white matter in the middle is white because of the myelin. The axons are insulated with myelin, which is whitish, yellowish, kind of fatty. But within that white matter in the middle, you'll have some gray matter, these basal ganglia, these little islands of neurons. But the gray is where the neurons are for all the connections. The white is the wiring. Yeah, and the corpus callosum, where the two hemispheres talk to each other. And then there'll be groups in here called tracts, right, that carry a whole bunch of axons doing a similar function. And then the spinal cord is opposite. The middle, that butterfly, is the gray matter, and the white matter is on the outside. They kind of split in the medulla to spinal cord. The cerebellum, you can see, beautiful, has this arbor vitae, the white matter looks like a tree in there, very, very cool. And then, yeah, here's the brainstem, the medulla and the pons, and then the midbrain. A lot of basic functions, everything goes, sensories going through it upwards, the motor's going down through it, and the cerebellum and pons can modulate that. The meninges are going to be important here. These are the coverings of the brain. And if you look at your skull, you've got, of course, some thick skin on your skull, the periosteum over the bone, and so you can move, there's a layer of fat there, you can move it around, right? And then on the inside of the skull, you're going to have a periosteum on the bone. And that's part of the first meninge, that dura mater, which means tough mother, dura mater. And it's going to coat the inside of the bone, and then it's going to make a really tough coat on the outside of the brain and down the spinal cord as well. And you can see here in the region, the midline here, two parts of the dura kind of separate a little. And you have the space in there is the dural sinus, which will drain the blood and then down the jugulars. Right? Then arachnoid means spidery. It's kind of a spider layer underneath. And then the pia mater is just stuck right on the brain, delicate layer right there. And the separation between the pia and the arachnoid is kept by the pressure of a cerebral spinal fluid is pushing that apart. So cerebral spinal fluid flows in the subarachnoid space between the arachnoid and the pia. And it is only that pressure. There's no connection between the arachnoid and the dura. It's just that pressure there. And so a close-up view here. Here's that important subarachnoid space. So that cerebrospinal fluid, that watery fluid is washing around, giving a waterbed to the whole brain. The cerebrospinal fluid will carry nutrients, carry away waste. Very cool. And then you notice in this illustration too, it's showing that there's the blood vessels in the brain are different. There's a blood-brain barrier, right? So glial cells, the astrocytes, go around all the capillaries in the brain and dictate what substances get to the brain. Yeah, so this fluid, it's made in the choroid plexus and the ventricles in the brain. You make about, I think, 500 mils a day. You have about 140 at one time. So you can see you're always turning over this fluid. You're making it in the choroid plexus. It goes into the ventricles. It travels in the two lateral ventricles to the third ventricle, down this little aqueduct to that fourth. And then it's going to go around the outside of the brain and all the way down your spinal cord. So cerebrospinal fluid washes, it protects the brain like a cushioning there. And it's carrying nutrients and getting away waste, and it's always being recycled. It's recycled, and the fluid goes back into your veins, and it's always being produced. So those two have to equal. Remember glaucoma in the eye? You made aqueous humor and you absorbed aqueous humor. If you made too much or didn't absorb enough, you get glaucoma, more pressure. Same thing here. You have to make a certain amount, you have to absorb that same amount, or pressure will build in your skull. Beautiful. And we sample this, is going to be important. So take a look at this with a spinal tap or a lumbar puncture. You could get it through the brain, but it'd be kind of dumb. You can just stick a needle in your spinal cord. Below, remember, below L2, L3, and then you're pretty safe. You're not going to hit the spinal cord itself. Lots of review here, right? Just real quickly. The blood flow, critically important here with strokes. Talk about that. But the blood flow of the brain, basically the most important thing is most of the blood comes from the two carotid arteries. And the internal carotid will go right into the skull, and that's most of the blood. But there's another system, back up, but going up, your vertebral arteries go up in those holes in your cervical vertebrae, the transverse foramen. They go up on either side. You're going to come together as this basilar artery. It's going to run up the base of your brain. And they all meet at the bottom of your brain in this circle, roughly. Not everyone has a complete circle, but the idea here is that if something is blocked off, another one can take over. Let's say your vertebral artery is closed, well, then the common carotid can come in. So the circle helps kind of equalize the pressure, and then the blood goes out to your brain through, most importantly, anterior cerebral, middle cerebral, posterior cerebral arteries that go to your cerebrum. Lots and lots of branches. And we'll talk about this middle cerebral in particular. You can see it here, the red there. You can see it's really taken a lot, including the motor part of your brain. So if that one gets a stroke, let's say you get a clot on one side, over here, then the opposite side of your body will be drooping. Will not, yeah, 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 cool. Depends where it is. And if you have a clot, let's say there's a blockage down here, turns out that vertebrals, they really do the brain stem particular. So that's really deadly. You know, if that's blocked, you don't have a complete circle, then you don't have any blood to your brain stem. You're not going to be able to live long. All right, I gave you a lot here, but take a look. Feast your eyes over that. See the carotids. You feel my pulse. Most of the blood going up to my brain, but there's vertebrals that come up, and they go through that foramen magnum, and they'll meet together. The very bottom of the brain is a circle. Circle of Willis. It's now called cerebral arterial circle. I'm trying to normally get away from names like eustachian tubes, auditory tube, because Eustachius and Willis, people don't remember them. All right, and this is this blood-brain barrier. Very important if you're trying to come up with drugs, because if you want someone to cure a headache, if it can't cross this blood-brain barrier, it's useless. And antihistamines, we have a couple generations of that. The first ones made you drowsy. Then we came up with non-drowsy antihistamines, and we just fooled with the molecule so that it no longer goes through that blood-brain barrier. So cool. And the purpose in your body is to isolate the brain from toxins and other things, just to give, the neurons are kind of picky, and so they're given this firewall, this shield between all the crap that's in your blood and the blood itself and the brain itself. Yeah. So you can see astrocytes are the glial cells that really do it, and they completely cover every artery that goes through the brain, completely encircling it. And the endothelium of the capillaries is really the gatekeeper, and then the astrocytes are telling the endothelia like what to let through, what to not let through. So blood-brain barrier, important to know what can cross that and get into the brain. So antibiotics, if it can't get across, you're not going to help a brain infection if your antibiotic can't cross this barrier. All right, I'm certainly not going to review the neuron anatomy. You probably got that in high school. The important glial cells in the brain, or astrocytes, are the most abundant, and they're everywhere. They make up the scaffolding in your brain, the blood-brain barrier, the whole, all along the surface of the brain. And when there's brain damage, the astrocytes will form a scar. So brain neurons are not going to renew themselves if you have a chunk of brain lost. It's just replaced by the scar tissue made up of glial cells, which are useless for thinking, but they fill in the gap. And the Schwann cells of the central nervous system are oligodendrocytes. So those are the glial cells. And Schwann cells will dedicate themselves to an axon. Oligodendrocytes have numerous processes, so they can take care of several axons instead of just being for one. But they speed conduction within the brain and spinal cord. All right. All right, so man, that was my review of what took weeks in A&P, but the important things, just so they're in your mind, so we can talk about pathologies. What are the most frequent and serious problems of the central nervous system? Strokes, or CVA, cerebral vascular accident. You'll see they come in two flavors. Either it's a clot, or it's going to be a hemorrhage. In either case, part of the brain is denied blood, oxygen, and it dies unless it's restored, the blood. It's like number 3 killer. It's up there. Traumatic injuries, definitely. Gunshot wounds, concussions, things to affect the head or spinal cord. Then we'll get to infections of the brain. Not good, right? Meningitis is going to do the meninges. Encephalitis, usually a viral infection of your brain. And then abscesses, you can take a look and see. When you look at these MRIs or CT scans, look at the symmetry of the two of them. If you see something that's not on both sides, then there's probably an issue, right? It's like easy to have it jump out at you like that. Alzheimer's disease, huge. I think it's a huge problem. I think 6 million Americans is expected to be like 16 million by a couple decades from now. So it's a form of dementia. Neoplasms, brain cancers. Talk about that. The particularly bad, you don't want to hear cancer. Brain's not a good one. It's often hard to operate on it, and even a small benign one can, in the wrong place, if it's going to take over some important functions like breathing or something like that, it'd be very deadly. We'll talk about some developmental disorders right away. Talked about Down syndrome with genetics already. Demyelinating disease. You guys remember what it was in the peripheral when you ate away at the myelin? Guillain-Barré syndrome. Yeah. In your central nervous system, it's MS, multiple sclerosis. Degenerative diseases, yes. And then when you look at people, the most common issue with your head is headaches, right? And then epilepsy is when you're going to have seizures. And so these two are not really diseases on their own, but they're symptoms of a lot of diseases, right? Yeah, so very important in their prevalence, morbidity in the population, but it's like headache is a disease. Many things can cause it. All right, so someone comes in and you suspect a central nervous system issue. What are the common symptoms? What kind of tests do you want to do? Well, headache, my head hurts. I have lost motor or sensory function. So you can go ahead and prick them with a pin and see what kind of sensations they have. Doing reflexes, very, very common, the knee reflex. You can do corneal reflex. You can do all kinds of things. Are they having seizures? Seizures are these, brain activity that where you lose consciousness briefly, usually, and you know what a seizure is. We've all seen it. And anything relating to ability to think properly. You can't concentrate. You lost your short-term memory. All these things. Yeah, looking at headache types can tell you about differences in migraines and cluster headaches, things like that. So what you want to do is take a look and look at their posture, look at their gait, look for atrophy of muscles, look for strength and coordination, test trapezius, you can see if your accessory nerve is good. So you can do these kind of tests, and if you see muscle wasting, you see lack of strength, foot drop where they can't lift their foot up, all these things are indicative of some nervous issue. Now, the nervous issue can be peripheral nerves, or it could be in the spinal cord, or it could be in the cerebrum. So then you need to be a detective and figure out where the issue comes from through various tests. But yeah, strength, coordination, reflexes, if their mouth is drooping on one side, all these things are clues. If their voice changes, things like that, that could be neurological. Yep. And cognitive function, your thinking. So you can look at, do some quick memory tests, have them do some arithmetic, and learn some things right there. And get a history, of course. Is it more common when you're tired? Do you have less memory? How long has this been going on? Is it sudden? And just generalized, when you look at this, you're going to talk about, is it focal or is it more generalized? So generalized, if you have a overall headache or like I said, loss of consciousness, whole body involvement, or is it focal? Do you have loss of sensation in one limb, or is it a specific area? Maybe you lost sensation along one of these dermatomes, telling you, maybe that spinal nerve, part of that spinal cord has a lesion. So is it a focal finding or is it a generalized finding? All right, ICP is intracranial pressure, and dangerous and easy to do, all right, because your brain is in a cranium that is solid. It does not give at all. Your chest gives, but your brain does not. So anything that takes up space in your noggin is going to cause increased pressure. So it could be a tumor that is growing. It's a bleed. You got a blood is growing in there. It's going to cause pressure in there. Some kind of, any kind of lesion that's growing or an infection that's going to cause edema is going to put pressure in that brain. And if you have intracranial pressure, you'll have headaches, then eventually you'll pass out, have coma and death. So it's taken very seriously. Usually if it is serious, they'll drill a hole in your head to release that pressure, put a tube in. So anything that takes up space is going to push on that brain. And you can see here, The only opening in the brain is that foramen magnum. So your cerebrum tends to be pushed down to where the cerebellum is. The cerebellum pushed down into that into your spinal cord. Not good, right? You don't want things to be moving around, herniating and being pushed in your brain. So intracranial pressure, you can measure it. Look at the optic nerve. If you do a lumbar puncture, there's ways that we can look at the intracranial pressure. If you look at a patient and maybe one eye, the pupil is dilated, something like that, and the other one's not, often means intracranial pressure because that oculomotor nerve, cranial nerve number 3, influences the pupil, and that takes a long path, and that will get pressed with intracranial pressure, and that'll be a symptom right away. If you see pupils are not the same and dilated, they're like, okay, they've got ICP, get them in, we need to drill a hole, we need to release that pressure, or the next step is coma, et cetera. So I sound very serious about it, intracranial pressure, but yeah, it's a serious issue, and there's many different causes of it. All right, the cerebrospinal fluid is a great clue. I mean, pee and blood is easier to get, so let's just say that. But often if you have suspected meningitis or encephalitis, something like that, they want to take a look at some cerebrospinal fluid. Well, you could go through the skull, but hey, we can reach it. The same fluid travels down your spinal cord. So once you're below, you do a lumbar puncture. You know your spinal cord ends L2, L3, and then so L4, L5, anywhere down there, you can push a needle in, and eventually you'll get into that subarachnoid space, and some fluid will start dripping out. You collect that fluid, and you can tell if there's blood in it, then that's not good. You could have some kind of, it's got to be some kind of bleed in the subarachnoid space. If there's a bunch of neutrophils, it sounds like it's an acute infection. You're going to see if there's, look at glucose, look at other things. So, I mean, they can do a culture of cerebrospinal fluid to see if you have a particular infection, what kind of organism it is. So, cerebrospinal fluid is a good sample of what's going on in your head. But it's a little difficult to get, as you can tell. All right, radiological procedures, obviously. You come in after head trauma. Well, do an X-ray. An X-ray shows you the bones really nicely. And if bones, it can be splintering. You can look at the bullet path, anything like that. So X-rays are really good for that. Now, often if it's a stroke or something like that, time is of the essence. They may do an angiogram. They'll inject some dye in the carotid and see where it goes. And if you see it's blocking, like here, oh damn, there's supposed to be blood going up this middle cerebral artery, but there's none, right? That means, okay, there we got probably a thrombus there, and this part of the brain is dying. This left half of the body probably is not moving, and so they can tell that. And then MRI even gives you more detail of the brain. So if you're looking, person with tumors, et cetera, if you have the money and the equipment, you can do an MRI and look at that. Headshots, yeah. Indeed, MRI or a PET scan, they can do that. A little more complex getting into that, but yeah, this is very, very common. A neurologist can read these MRIs, these PET scans, these CT scans, and know just what they're doing. And the beauty with computerized CT, computerized tomography, they have all these slices, and you can look at it, go in and out, and identify bleeding, identify lesions, and all these things. Or you can do an EEG, not an EKG or an ECG with the heart, but an EEG is an electroencephalogram. And you can put these on your head. They really want to know, they can put them inside your skull, but it's drill some holes. But you get to look at the brain waves. And there's a characteristic electrical impulses from your neurons. And we know it varies when you're sleeping, when you're having a seizure, this kind of goes nuts. And they can identify parts of the brain maybe that are firing uncontrollably and epilepsy, and they can take a look at that. It's also when they look at brain death, they look at brain waves to see if there's things going on. All right, how's that? So lots of imaging techniques, and the obvious things like testing cognition, looking at their gait, testing for sensation, doing those reflexes that we learned in A&P with the knee and other reflexes. Looking at pupils, do they respond and are they symmetrical? Do they still have taste and smell? All these things are clues to various diseases that could be going on up there. All right, genetic developmental. So it turns out people are highly variable with this. Some people with some developmental abnormalities appear absolutely normal with very few issues, and others are severely impaired where they're living their life in a hospital, they can't feed themselves. So yeah, you guys know this whole spectrum of manifestations, right? So you can see, we'll see malformations occurring. That usually occurs, the brain develops in that first half of gestation early on. So the last 4 months or something, the brain has already developed. But from that point on, you can get some brain lesions. You can get issues that arise. But your brain forms early in development. It forms as this tube, actually a groove that forms as a hollow tube. And then from that, it's going to bend and bend and make all the rest, all the ventricles are the hollow insides. And so the development happens really early on. And then most of pregnancy, the brain simply grows, and then things can happen to it. But the development happens early on. Yep. So malformations, definitely first half of gestation, as I was saying. And the issues, what can cause this? It can be genetic. And many of these are not compatible with life. And so there's a spontaneous abortion and miscarriage, and that's it. But some make it through. And then it could be during that development, right? You could have toxins. So we talked a lot about that, right? Teratogenic. Hypoxic events, if the embryo doesn't get enough oxygen, atherosclerosis, or mother with hypertension or diabetes, some kinds of trauma, exposure to drugs and alcohol, things like that. That happens early on in pregnancy, it's going to cause malformations. Yep. And see, this is anencephaly, where you don't even develop most of the brain, and so you don't survive very long from that. And of course, if you have a malformation early in the development, it's just carried on. So usually it's severe cognitive issues. All right, a chromosomal abnormality we've already talked about is Down syndrome. You got trisomy of number 21, you got 3 copies. And it varies widely in intellectual capabilities. Some people with Down syndrome live independently and are very, very high functioning, and many have very low IQ. That comes with other issues, right, in the heart and things like that. So that lifespan is shortened, but having 3 chromosomes, it's one of the few chromosomes you can have trisomy and have a fairly have an outcome that is can be have a person that's quite independent and have intellectual abilities that are not far below average. All right, the spina bifida. This happens when during development, it starts out as a groove. It comes into be a tube, and what can happen is usually in the lower part of the spinal cord, but actually it can be anywhere. It can be up higher in the neck region or up in the head. You have it doesn't completely fuse the neural tube, and you have an opening. And so many of these are not compatible with life. But you can have spina bifida where here we're just missing some the tops of the vertebrae. There's a hair, a little patch of hair in there. Strange, huh? On that region. A meningiocele where the meninge actually bubbles out like a bubble on the lower back. And then a myelomeningocele where the meninges, the dura mater comes up and the spinal nerves come up there too. And so that can be a real issue. And so they can do some surgery on these if they're not too bad. Yeah, spina bifida. Being pregnant, having folic acid is a big thing that can prevent these neural tube defects. And so as I mentioned, if you're of childbearing years and a woman, you should probably take folic acid in case you get pregnant. You usually don't know in those critical early weeks and months. And so it's been shown that folic acid helps prevent neural tube defects like spina bifida. And then anencephaly, yes, very sad. Normally, well, hopefully you can see this in the ultrasound and they make some decisions about whether you want to abort or I'll bring that up, but it's not compatible with life, and usually it doesn't make it to birth, or soon after birth it's gonna perish because the whole forebrain doesn't develop. Yeah, so it's like spina bifida, but a serious form of it. Yeah, and then it's just like cool. This came from a brain museum, this lissencephaly. There was a mistake where we didn't make the gyri, the convolutions, and so this person was severely mental issues, but showing some weird brains. All right, so destructive brain lesions and issues happen after that first half of pregnancy when the brain is formed. So that's when you've had chances to have developmental problems. Now you have issues that are assaulting the brain and causing some issues. And we say it occurs the second half of gestation up to like 2 years old. So this perinatal period and up to 2 years old, when some brain destructive lesions can happen. And most of these occur right around birth and delivery, where you have oxygen cut off and maybe the cord is twisted, things like that, or the abrupt placenta. Something is going on during that childbirth that deprives the brain of oxygen. Remember, within a few minutes, it can cause brain damage. And so when you have this around birth, it can cause what we call cerebral palsy, which is not as easy to define. Here, the son in the Breaking Bad, he's awesome. That's cerebral palsy. So you can see it doesn't necessarily mean you're going to have mental deficit, although many times you do. There's a big spectrum. So cerebral palsy, we think it's caused, well, we know it's caused with some kind of insult, toxins, lack of oxygen during that childbirth region, where you come out with issues that are involving usually motor skills and intellectual skills. Yeah. But varies greatly in severity from no mental issues to severe mental issues. All right, inflammatory diseases. We're going to talk about infections, the ones that particularly that affect your brain. You guys are meningitis, they worry about that in college dorms, et cetera. That can kill you quickly, right? It's infection of your meninges, the arachnoid pia mater, right? Encephalitis also. You don't want to hear about infections in your brain. They're hard to get rid of, and they can quickly lead to death, right? We'll talk about rabies, and then myelitis, hit polio again. So meningitis. This is going to be an infection of your meninges. And it's usually by bacterial. It can be some viral, fungal, protozoal. So this is an infection of the meninges. And it can be associated with pneumonia and some other infections, but it can just be on its own, just you have meningitis. And we'll see, it can be abrupt, where you have terrible headache and you don't see the light and your neck is stiff and you have fever. And then you go to the hospital. I mean, if they suspect meningitis, and it's also forms that are very contagious too. So with meningitis, this infection in meninges, let's take a look. Yes, fever. This neck pain is characteristic. If you have this neck pain, that's a red flag that, oh, you have neck pain. You could have a sore neck, but it's definitely a sign of this. Sleepiness, vomiting, joint pain, rash, headache, seizures, light sensitivity. Yes, all these things are a clue of meningitis. So different kinds of organisms can cause this. Let's see, newborns, E. coli, most likely, or some strep, and then small children, influenza, you recognize that, and this Neisseria meningitis. That's the one especially that is an issue in epidemics of meningitis. I put it's a uni dorm, I just put in there. There's no meningitis there. There's nobody there now, actually. But it can happen in dorms, and it hits meningitis, people of your age, people, the teens and early 20s. They tend to congregate, like say in dorms and schools and that kind of institutional settings, and can be transmitted by kissing. Not that everyone kisses, yeah. I can get into that, but it gets droplets. This is a bacteria that is very transmittable, and so you're transmitting meningitis, an infection of the brain. So it goes through the blood and it makes its way to the brain, and where it takes up residence, starts growing, and these bacteria can make pus, and they can grow in the brain and form these intracranial pressure and it caused death. So meningitis, they worry quite a bit about. Luckily, there's a vaccine for meningitis. So people are often vaccinated before they go dorm, school age. Yeah, so you can see if they know what the, it's good to know what the organism is that's causing it. Yes, in this one, this Neisseria one here, it's normally a bacteria that's carried, you can see by 15%, just carried by the population. It means it's not growing on your meninges, but you have it, right? And then during an epidemic, that can double. You can have 30% people carrying it. And yes, meningitis, look at this 10% mortality. Yeah, look at that COVID mortality, other mortality, scary diseases. So meningitis, like I say, it's something that can rapidly progress, infection meninges. And so they often want to know right away. And so even though it could be viral, they often want to give you antibiotics immediately before they even do a spinal tap, just in case, because time is of the essence to get this thing. And even people that survive meningitis, it's like a 20% case where people have lasting effects of having it. Yep. So again, the stiff neck, the photophobia, the headache, the nausea, and especially if you've been in contact with people they know, they're going to hit you with antibiotics quick. They'll take a cerebral spinal fluid, because if there's an infection up there, they'll be able to tell. They may be able to get the organism itself, and they'll be able to get neutrophils that are fighting the infection. Decreased glucose, I'm guessing, because the bacteria eating it, taking it up. Yeah. And you'll be able to culture it and say, oh, okay, it's E. coli or it's Neisseria, whatever it is. All right. I want to say any questions, but this lecture is very one way, isn't it? So yes, serious antibiotics that can get into the blood-brain barrier and get to that stuff. Yeah. If it's untreated, like I say, it's a very, very high rate of mortality. But yeah, you can break down, this infection can break down that blood-brain barrier, causing edema, brain swelling, causes intracranial pressure, coma, death, right? And when you guys know what purulent exudate means, right? Purulent exudate is pus, right? And so this will form, and you'll see that. Imagine that pus in your subarachnoid space, not good, growing on your brain. All right, so that's meningitis I'm talking about here. You catch it, is it acute? I mean, you get it, and within days you have, these symptoms, and then you have days to really treat it too. But there is chronic meningitis. You can see by that organism that cause TB, fungal organisms. These things, like they can smolder at the base of your brain, definitely. And so instead of neutrophils, you'll see more like long-term immune cells, like the lymphocytes and monocytes. Yeah, here it's showing, you can see the infected meninges here. And looking at, like I say, hitting younger people, mostly because of the social aspect there. And then meningitis, look at bacterial meningitis. This band in Africa is a real big issue for bacterial meningitis. They watch that quite a bit. All right, so infection of your meninges, meningitis, my own nerve. Now encephalitis is going to be, remember cephala means head, it's your brain. It's going to be infection of inflammation of your brain. So this is usually viral, although it can be bacterial, it can have other organisms, but it's usually viral. So what does that mean about treatment? What do you guys know? There ain't none, right? Pretty much they wait and see. You're either going to get better or you're going to die. Yeah. So the ones that you hear about are kind of scary, like West Nile, right? You worry about these mosquito-borne encephalitis, really bad. And I looked up in Maine, there's an equine encephalitis. I saw there was a case in 2015. But so there's many versions of this virus, especially other parts of the world, that is carried by mosquitoes. You're going to have drowsiness, headache, irritability. You have an infection of your brain. And so they want to find out what it is. So take some cerebral spinal fluid and try to see what it is, and see if we have anything we can do. At least we can know what the causative agent is and take a look at what would be the best treatments. But you either die, which happens often, you recover, or you recover and you have some neurological deficit from this insult in your brain. Some encephalitis, herpes virus, the HIV virus can cause it, or secondary to it, remember toxoplasmosis, it was a protozoan. You worry about changing the litter box if you're pregnant, it can cause toxoplasmosis, or another virus that goes along with HIV. So they can also cause that, yeah. So meningitis and encephalitis are similar, but meningitis is the meninges infected, it's usually bacterial. Encephalitis is the brain and it's usually viral. And both are serious causes of concern. All right, then rabies. Now rabies causes a lot of fear among people, and for damn good reason. You do not want to get rabies. And we have a vaccine for it. And there's a story of a kid, parents didn't want to get vaccines. He got rabies, died an excruciating death. And they spent over $1 million, trying to save him. But it's actually tetanus. It's a damn good story, all right? But it's another, this is a tetanus vaccine, which easily takes care of it. But if you get tetanus, also really bad, causes muscle spasms, and it's very, very deadly, but we have a simple vaccine. You guys all have your tetanus vaccine, right? All right. I had a similar idea to rabies. Now, rabies, we don't normally get vaccinated for. People that do are veterinarians, they are animal control people, researchers that work with bats, they get rabies vaccines. The vaccine in most parts of the world is about $50–80. In the US, the vaccine series averages about $750. No wonder we don't all get vaccinated with it. I got an extra grand to throw in. And of course, won't get into that. But the rabies vaccine works very well, but it's just used for people that have a lot of contact with these animals. Okay, so anyway, rabies, we know it's we get our pets, dogs vaccinated. We do a great job here in the U.S. It's because it's required, so we do that. People don't seem to have a problem with that. But if you look at the world, this is just for dogs that have rabies. All right, and you can see North America really good, Western Europe, Australia, Japan. These countries, we pretty much eradicated it in our pets and our dogs, and actually a lot of wild dogs other parts of the world. Here we keep them more as pets, but I digress on that one. But if you have rabies, if you're bit by an animal that has rabies, and it's harbored here, we have it here in wild animals, particularly bats, and foxes and skunks and raccoons can carry rabies, and they can infect your dog. And then your dog gets rabies and it's going to die, but before it dies, you all see an old yeller, right? It's going to start foaming at the mouth, getting vicious, and then it can bite you and you can get it. So it starts out with, it enters the body at the bites and the saliva, and it travels in the nerves, and it's going to keep going up towards your brain. And once it reaches your brain, you're going to die. Yeah, that's about 100% death. So that's why it's so scary. But luckily, it's very, very rare. A couple people a year, in the U.S. die. Some of the things, yes. So you're going to have fever, malaise, vomiting, and then you have when you try to drink water, you can't. So you have this hydrophobia. You can't drink water. You can't swallow. And depends how far away you're bitten is how long it's going to take to reach your brain. But if you are bitten by a wild animal, let's say, God, I was bitten by this fox. It's actually really weird. It wasn't scared of me. Well, shoot the fox. You like to bring the animal in to get tested. So if you know it has rabies, because if you know it doesn't have rabies and it got bitten, you can save yourself a lot of shots, right? If in fact you really suspect it has rabies, often it bites and it's gone, you don't know. So you're going to get the rabies vaccine, which is expensive, and then they're going to try to give you antibodies, globulins, to try to prevent it from reaching your brain. So the rabies vaccine is a series of shots, and they'll do everything immediately to try to save you. if it is in fact a pet or something, they'll just wait. And if it's, 12 days, if the pet doesn't die, it probably doesn't have rabies. And so they can, you can rest a little easier. So yeah, so rabies, it's pretty deadly, but we have a system of vaccinating against it here in our pets. And so it's not harbored there, but it's still harbored in wild animals. In other parts of the world, rabies is much more prevalent. Oh yeah, so look at, so our beautiful animal vaccination program has nearly gotten rid of it in our dogs. But so where can you get it from? Bats. Yeah. And people don't play with bats too much. I love watching them got a little fire in the backyard, and they always come out. I love bats. But researchers that work with them, and then people will find them in their attics and they get bit by it. And they're not all going to carry rabies, but there's that, you can see 51 cases. Oh my God, this is over a long period of time. So we worry a lot about rabies, but you're unlikely to get it. And then, yeah, people that travel outside the US get bit by the dogs out there are much more dangerous. And this is highest mortality rate of any of these diseases that we're talked about without treatment. Yeah, you get bit by a rabid dog, you don't do anything, you got a 0.1% chance of survival. That's serious. So, yeah. All right, and the last slide for this first half is myelitis. And so we're talking about affection of the spinal cord. And the one I'll talk about is polio. Well, poliomyelitis is the full name. And I already kind of introduced it to you. We talked about peripheral, the nerves, and we talked about muscles. And so this affects the gray matter in your spinal cord, and that's the bodies of these motor neurons. And so you're going to have this progression, usually lower limbs. The muscles are going to atrophy, and it's going to continue until, look at this iron lung unit. And this was huge in the summer of the 50s until you got to the vaccine, yeah, 60s and beyond when I was born. Polio has been eradicated. It used to be hundreds of thousands of people got polio, and there's no cure. It's a virus. Yeah, and this graphic shows it beautifully. Look at that, 1988. All these countries had it. We just, like smallpox, we just put our minds to it that we want to eradicate this disease, and we can with everyone immunized. I think we're left with 3, maybe 4 countries you can get polio. These are some places that don't have a good healthcare system, and there are issues involved with culturally and wars and things that make it difficult to finish the job. But we will eradicate polio. It'll be a thing of the past. All right, great stuff. All right, this part 2, we're going to start off with talking about strokes. Talk about strokes and brain cancers and some other things. So, all right, hope you enjoyed.